Hi, Charlene. It looks like you made it. How are you doing? Did I unmute you? No. Let's go get this other.
Hi, can you hear me?
Hi, Charlene. Yes, I can hear you. How are you?
Oh, well, as I say, I'm okay, but I just
Okay.
wanted to be sure that I hadn't disappeared with the screen, which can happen anytime. My voice, whatever.
So you have power and everything? Oops. Hi, good afternoon. Thanks for joining us. This is Vicki Lowe, Executive Director for the American Indian Health Commission. We had about 73 people registered, so I'm just going to wait a couple more minutes and make sure people are able to get logged on. So just hang tight for a minute. Thanks. Hi, Steve and Cheryl.
Hi, how are you?
Good. How are you guys?
Good.
We have Charlene Nelson as well. I'm not sure if she's able to turn on a camera or not. And people are still logging in, but
I'll turn mine off right now for a little while and just wait.
okay.
How would you turn on the camera? Up at the top, it says webcam, Zoom, screenshot.
Webcam?
Yeah, click on it and it will ask you if you want to share your webcam and you say yes. Click on it and say yes or share.
I'm not sure I do. You're kidding. Okay, connecting, preferences. That's all it said so far.
Okay, I'm gonna click on something. It's gonna send you a request, I hope. And then if you
Okay,
click on
here
it.
it is. Share my website. Ah, here I am. Yeah. I did it. I don't see me.
Yeah. Maybe your camera's not working.
Okay.
Yeah, mine's working.
Okay, wait a minute. Just click to, okay. Hmm.
I don't see Secretary Weisman yet, but we did arrange for the package to be delivered to his house right at 1 o'clock. So maybe he'll be on in a minute. Do you want to go ahead and get started, Steve? Or you want to wait a few minutes? We've got about 29 out of 70 people.
What is it, about 5 after?
Yeah,
Should we give them another 2 or 3?
sounds good. I was in, we could talk about the announcement by the governor too, but I was hoping Secretary Weissman would be here for that as well.
Vicki, can you see Terry's
Yes.
message? Okay.
So Terry says John was on a conference call with the governor right before this meeting, so he should be on soon. The package has been delivered. That sounds very 007. So Steve, while we're waiting, can I go ahead and kind of share where people can find things on the website real quick?
Yeah, go ahead. Go ahead.
So thanks for joining us. You know, this has been a very different way of doing our summit and certainly not as fun as when we're all together in person. So we started on November 5th and now we're ending on November 17th. We're getting all the materials up on the website. We've recorded all of the sessions and the breakout sessions and the materials. So if you go to our website, either if you go to the home page, oops. See the standard virus picture. And then right up here at the top, it says meetings and events, and go to Tribal and State Leaders Health Summit. Should be able to find all of the documents. Aubrey's still getting them up. So like here's the PowerPoint that we had during the opening on the 5th about all the work that was done during since the pandemic. started. And then there's videos. You have to register to go in to see the video because they're keeping track of how many people watch them, but you just put in your name and address and it'll take you to the videos of the sections. And then other, if there was a lot of information, I don't know if this one's up yet, there'll be a folder and it'll have all of the materials that were in there. So that's just kind of a quick overview. And then I hope everybody followed along with all the changes that were going on. First of all, we made an agreement with Goya to use the end time of our summit to do our Centennial Accord prep, which worked out really great because we were already talking about all of the things, as you can see here, that had been issues last year, and we added some new ones. So we'll be talking about that this afternoon. And then of course, when the new order from the governor happened on over the weekend for today, then that changed how we were honoring Secretary Weisman, who is here now, yay. And then we couldn't really have any singing or anything because you guys do not want to hear me sing by myself. So that's where we're at, Steve. I think we're ready to get going. There's Cheryl.
Okay.
Steve. Yep, we're good.
Let me see. Is somebody still having trouble getting on? Could I have somebody offer a prayer, please? Would somebody be willing to do that?
Steve, this is Charlene Nelson. I would be honored.
Thank you, Charlene.
Almighty God, Creator, Master, we give you thanks. We give you thanks for us being here today. We give you thanks for being with us in the storm. We give you thanks for all the people who help us and that we laugh together and enjoy seeing one another. And we know we'll do that again. Please be with us today. Help us. Stand with us, and we know that you always do that. Help all the people that are ill with the COVID-19, and help us all, God, to take care of others by taking care of ourselves, using masks, not going out, not being where we could pass it to anyone else if we had it. Again, give us joy in this day. Thank you. We have joy in this day. Help us to always remember that you are with us. Hawa Salana, Masi Masi. Amen.
Thank you, Charlene. Well, this is the end of a meeting in an interesting year and an interesting meeting. I would have to say I suffered from this not being an in-person meeting because it's too easy to get pulled away, and we all have multiple things that pull us away at this time. So I think so I regret that I missed so many of the sessions that I would have liked to have been to, and I'm really interested in listening back and hearing what people had to say, and I hope that we can power through this period in our life, and that we're at a different place 2 years from now. That we're in a safer place, we're in a more stable place, place that we're healthier and a place that we're back focusing on things that are so important in our communities. So I want to maybe turn this back over to Vicki and our staff for whatever you have prepared here. And John, we have some things to say to you. I guess they had to use UPS or I don't know, maybe Uber. I'm not sure how they got it to you so quick. So go ahead, Vicki.
Sure. Thank you for the prayer, Charlene, and thank you, Steve, for opening us up. Secretary Weisman, you should have a box, and this is not how we normally do things. This is so outside of cultural norms, but we would like you to open the box. And normally, you know, our plan was to have, I think, Tamara and maybe Terry there, but you know how we say thank you and much appreciation for your work with us is we want to honor you by wrapping you in a blanket. Unfortunately, you have to do the wrapping, which is really awkward. But we're also the secretary of the Department of Health, and you know, more than anybody, we hope you can understand that. So. Yeah, I remember the first time I met you, it was at a summit, and you came and you stayed through the whole summit, and it was just so impressive that the lead of an agency for the state would stay, and really you were like engaged the whole time. I think we wrapped you with a blanket then. Yes. And so we just want to thank you for really staying engaged with us through your entire tenure here. We're gonna miss you, and I'm actually tearing up, which I don't do very often. And I think, you know, one of my favorite stories that I want to share about you, and then I'll hand it off to the executive committee and they can make their comments, was when, you know, you worked really hard to try and get us engaged with the Foundational Public Health Services, the tribes, and it just, we weren't getting any traction. And then finally, you know, Aaron, thank goodness, Aaron Spark really was like, we have to get involved. So as the executive committee, we're going to step up and we're going to start going to the steering committee meetings. Well, that first meeting did not go very well, if you remember. We weren't, and it's gotten a lot better, but we weren't very welcomed. We were kind of easily insulted, I guess. And after being in the room for, I don't even know if we were in the room for 15 minutes, either Aaron or Andrew stood up and said, "Tribal caucus," and we got up and left. And you came to the room that we were in. It might have even been your office. And kind of talked us down. And that was, I mean, that kind of leadership, and then brought us back in and really helped us to figure out how to get along with the LHJs and you know, the county people and really have a better understanding of each other. They have a better understanding of us. We have a better understanding of the work they do. And I think that's really just a story that shows just how you are on a regular basis. So I really want to raise my hands up to you. Where's my, and thank you so much for all of the great work you've done and how you've kept the tribes included, especially in this time with the COVID response and trying to help us really keeping the communication open and working together and making sure that we're keeping all of our citizens in Washington state safe. So thank you very much.
Thank you.
Charlene, did you want to go next?
I could go next. Oh, I love to be on the floor. You did realize that I'm an elder, and once the elder is on the floor, you can't get them off. Let's see. Somebody says you're only supposed to talk 2 minutes. Oh, that's a big mistake. Anyway, John, I'd like to say some things that I feel that you showed us. Kindness. And you had a sense of humor. Or you have a sense of humor. you're taking it away from us, but no, I'm sure you're going to contact us sometime. You're steadfast. You didn't give up. And trust. I could trust what you said. We could trust what you said. I'll miss that. I'll miss you being there, John. I wish, John, for you and your husband, great happiness and the best of all luck in your new job. And around my neck, which I could have showed you, but unfortunately I can't make the camera go, work. I have a band, a neck piece that is a gift from Lummi. And when I wear it, I think of the family in the canoe. They worked together and they took care of each other. John, you did that for us. Mossy.
Thank you.
Thank you, Charlene. Cheryl, do you want to go next? Did we leave?
Can you hear me? It says I'm unmuted. Okay, perfect. Thank you. So when I was a little child and my grandfather gave me my Indian name, he told me I needed to learn to live in two worlds. And when I think about you and what you've done for Indian country in Washington State, you have lived in two worlds. You've learned to make things work for both sides of. You made it a balance. So I appreciate that. Swimmers appreciates that. And I wanted to thank you for your time here, and I wish you well in your future.
Thank you.
And Steve, where'd you go? Steve,
I'm here.
can
I'm
you?
here.
We'll why don't you go
John,
ahead and then we'll get up.
I want you leaving this state, going back to. Are you going to University of North Carolina? Where are you going? Chapel Hill, is
Yes,
that what
yep.
you're doing? They have a
Right.
good they have a good MPH program back there.
They do.
I want you going back there knowing that you've made a difference in Indian country in the time that you've been working with us, both here and as secretary. You've made huge differences. I would say because I believe because of your leadership, we're participating in foundational public health. I don't think it would have happened probably without your leadership and guidance and pulling public health and the state along with it. And I say that from the bottom of my heart, John. And the engagement that we've had with Department of Health as tribes is unprecedented in my mind also. So there's a lot of things that you're going to be able to teach the people back in North Carolina and the people that come there for the programs. I think that it's my belief that what's happened with this pandemic is going to revitalize the interest in public health programs. And is that the one you're going to be teaching in, by the way?
Yes, it is. Yep.
Yeah. So it's going to revitalize the interest of people interested in going into this career field, because people can see so many different ways that are not the traditional ways in public health that these trained people can be utilized. And so the other thing that I think that you're going to be able to tell them is why it's important to work with Indian tribes, no matter wherever they set up their practice and they go to work or they live in those communities. sometimes some of us are a little hard to get to know, but once you have a friend for life. And so I want you to know that here you have a friend for life in Washington State. I want you to know that. And sometimes you may want to have some of us drag some of us back there and really talk to them about when you put on some of your seminars or whatever you're going to do that pulls them out of the normal humdrum of all of the public health stuff, of invigorating their interest to come and work in Indian country, to work in the U.S. Public Health Corps, for example, to do all of these type of ways that they can serve Indian people and come and take jobs in these communities that are out there. And I hope that you can make a difference, because I think that they might even have a school of medicine and a school of nursing there, I think. And so I don't know whether they have a dental school or not there, but yeah, one of the community health nurses that worked for me twice in my 20-year Army career, once as an LPN when she was enlisted, and once as a nurse after she received her nursing license and came back, went back there and was getting her degree in informatics from University of North Carolina, I think in Chapel Hill. But it's a good program, and I think that there's a lot of opportunities if people get invigorated and really have somebody talk to them about service. Because that's one of the things I think you've brought is serving your community, serving the people in your community that are kind of the silent people out there. They're kind of left behind in everything. So those are just a few things that I have to say. I have a special gift that's coming from me. I'll have to get it to you sometime after I get all the paperwork cleared away, which I'm working through the process. And I don't see the governor on here, but I know that there's a way that I can get this to you that they don't make you return it to the state. And
Yes,
so
we worked that out.
Oh, you have worked that out?
I think so, yes.
Well, because the last email I saw, you couldn't work it out. So I've been reaching out. You have worked it out?
I think so, yep.
Okay. So then you will be hearing from me. So I want to give some time. I want to give some time for other people to speak, because I know that there's people online here that have worked with you, and I just want to thank you from the bottom of my heart, all the things that you've done to help us.
Thank you, Steve.
Thank you.
Thank you, Steve. So if you want to talk, just raise your hand and Lou will unmute you.
Quickly, the last thing is the cleanup of
Hello?
I just had to mute here just a second.
And Jan, while we're waiting, I put you in a position to unmute yourself if you want to go ahead. Oh, I see. Tamara said I cleared that through the legal team this week, which is good because it'd be really culturally inappropriate for you not to be able to accept a gift.
Exactly.
Have that conversation. Jan?
So John, as everyone else is talking, of course, I'm reflecting upon many conversations and many times where we have worked together on particular issues. Certainly bringing the leadership quarterly meetings together and all of the conversations that took place there. I particularly remember a time when Marilyn Scott and I were invited to participate in your first retreat. And we presented the Pulling Together for Wellness framework and the 7th generation principle. And you were very struck by that and asked if you could use that in the state's work. I think it wound up in one of the documents, the state's plan. And anyway, and so we were just so impressed that you saw the value in it. We certainly saw it, but you saw it and you took action. I feel that great friendship with you. I know, I mean, I personally am going to miss you very much, but understand you're wanting to go back to your alma mater, right?
Right.
Yes, and do that great work and teaching the youth. So I hope you're thinking about that 7th generation principle as you're back there, and you know, doing sharing forward that message too. Thank you, John. I know I'm friends with you on Facebook, so I hope to stay in touch. Take good care, and yeah, you do have a piece of my heart.
Thank you, Jan.
Lou, are you able to unmute Nancy Dufresne? She can go next, and then I think Heather wanted to say something.
Nancy, you can unmute.
Yep, thank you. I was talking and realized I was muted. John, we've met in passing many times. I want to echo Steve's words of the great opportunity that you offer to all of Indian country in your next phase of education and academia, and passing on what you have experienced and learned and taught here in Washington State about the importance of Native communities and Native health, and the opportunities for not just Washington State, but the nation and all of the tribal nations that we partner with. And I want to wish you goodwill, good fortune, and strength, because these are hard times to move, and they're hard times to reorganize and restart. And it's going to be difficult, but it's not impossible, as you know. On a personal note, I also want to thank you for your leadership with the state LGBTQ community. On a personal level, the presence and the opportunities that you have given our gay brothers and sisters in state employment, and the recognition is very personally heartfelt, and it is something that, again, goes to your character and your leadership and your commitment to equity for all, not just because of our familial stances, but also because it's the right thing to do. And I just want to thank you. Good wishes to you and your husband. Watch some women's basketball, not just men's basketball, and cheer them on.
Great. Thank you, Nancy. Appreciate that.
Andrew, did you want to go next? You're unmuted.
Thanks, Vicki. And yeah, I have a few words for John, and a great big thank you. I remember one of the first Foundational Public Health Service meetings that we sat down in the big conference room in Kent. No, it wasn't Kent. Were we at Boeing Field that day? It was one
Maybe.
of the early.
I think you're right.
Yeah, and I remember people kind of looking at me like, why are you here? And you starting that path with us together to educate, to cajole, to encourage people to understand how important tribal communities were to their community. And I just felt so fortunate to be a partner with you on that journey. So thank you so much for recognizing the tribe's importance to Washington State's public health. which really culminated with us being recognized in statute as part of the public health system. And that's going to live forever. And that's through your work and your caring and your love for all the people here in Washington State. And so again, thank you for encouraging me to be part of that journey with you. And I want to thank you for your leadership and my deepest gratitude through these challenging times. And we're going to miss you. I kept hoping you'd change your mind and you'd stayed, but I totally understand wanting to get on to your next adventure. And I wish you I wish you the best for you and your partner, and enjoy North Carolina, but know that you'll always have a place to stay back here in Washington State. Thank you so much.
Thank you, Andrew.
I'm sorry, my puppy is barking. Heather, and then Cindy.
Hi, Secretary Weisman, Heather Erb here with the Commission. I personally wanted to thank you. I think as an attorney to another attorney, right? Because you practice law, and I just appreciated your precision and your logic, which doesn't always happen with governmental bureaucrats. But and as Nancy Dufresne said, you know, you were always about it's the right thing to do. And so it wasn't just about following the law. And as we know, tribal Indian law can be really complicated jurisdictionally. And I just really appreciated, like, when we were working on the consultation policy, you actually took a red pen to it. And as a secretary, I was just so impressed because I know how incredibly busy you must be, but you really took the time to get it right and to honor tribal sovereignty and really make Washington State, help make Washington State a national model in tribal public health law, and getting the attention of CDC and all the great work that's been done here, and just to be cutting edge, but also at the same time, just really honoring the law when it comes to tribal jurisdiction and authority. So I just really appreciated that. And I learned a lot from you, and I just appreciate all the opportunities I got. So thank you. And good luck to you.
Thank you.
Thank you. Cindy, are you able to unmute?
Hopefully. Am I unmuted? Hi, John.
You are. Hi, Cindy.
I, of course, also want to say Ganesh Chish, John, it's been such a great time to work with the Department of Health. I love my work with the Commission and partners at Public Health, and you have been a big part of that. You know, in my career, outside of Indian country, I definitely have heard a lot of talk, and not often do we see a lot of walk. And so it really is a pleasure to work with someone who wants to be totally aligned in what they say and how they work. I, again, love my work that I do with the Commission and the tribes in Washington State and urban programs. And I've been fortunate enough to do some work, presentations with folks outside. And when they hear about the work we're doing, they're just like, whoa, what is going on in Washington State? And of course, I know a lot of that credit is to our tribal leadership and urban Indian health leadership, but it's also to the support of our partners like you. And I just want to echo how important some of these changes you have made are for us, and how deeply and heartfelt we appreciate it, because really we know how to take care of ourselves, but we need a little help sometimes in breaking down barriers. And so when we have that opportunity, that's wonderful. And I just think back to my days of being a student in the public health. I went to the University of Hawaii, just loved that. And public health, you know, public health people, we think everything touches public health, and everything touches public health touches everything. And so I just, I've been thinking of your students and you, and how exciting this is going to be, all those minds that you are going to touch. And we just really need more public health people right now. We need everyone to understand the importance of public health and everyone's health. And I think you're just going to be a perfect person with all of your experience and knowledge, and I just hope you have a really good time, have a lot of fun, and I know you're going to be an inspiring teacher. So good luck. We'll see you again.
Yes, we will. Thank you.
Thank you. Marilyn, I believe I unmuted you. Maybe not. I'm really not good at this. Lou, you want to help me? Oh, okay. Now try Marilyn.
There, I think I'm unmuted.
Yes.
Good afternoon, John.
Good afternoon.
I just wanted to take the time to thank you for all the work that we've done together in the state and the tribal government. I just think back to the beginning of the work when you initiated the foundational public health work group and reached out to the tribes, wanting the input from the tribes with regards to the development and the transition of public health in Washington state. And I have to be honest, I was resistant to be that leader to participate on the work group. And I worked very hard to try to identify additional leadership from the tribes to participate on the work group. I was able to get a lot of technical assistance from the tribes to support the work of the work group, but I was not able to get additional tribal leaders to join the work of the original work group. But that experience was just very pleasant for me to be able to share with the work group participants who were very interested in learning more about the tribal governments and the sovereignty of and jurisdiction of tribal governments in the state, but they didn't know where to go or who to ask. And there was a lot of myths and misinformation that I was able to dispel some of that misinformation to the leadership of the mayors, the county commissioners, those that served on your work group. It was an experience that I will. And I just thank you for uh, being patient, because there are many times that the work group met and I tried to make all of those important gatherings, but I know in the end that many of the participants of that work group very definitely understood from the tribal government perspective the authority and the jurisdiction. And I can't say that it wasn't because they were not willing to know, they just didn't know where to go and who to ask. And so with your leadership, and along with the governor's cabinet members, the coordination between all of the departments responsible for healthcare in the state, we have done a lot of work and moved things positively in a direction that improves access for healthcare in Indian country, partnering with the state and the federal level. The one other thing I just wanted to share is that I know that in the beginning days of your appointment, we were able to get a scheduled visit with the Swinomish group that was wanting to share the indigenous standards and measures. And you were willing to listen to the opportunity that the Swinomish group wanted to share, and the national level was not ready for that type of transition or change. And but you were willing to participate in a presentation with the staff of the Swinomish tribe, and understanding a little bit differently from the Indigenous perspective that we look at measuring our success in different ways. So thank you for that time. And I wish and I challenge you in your experience here in Washington State. And it's always important that we give you the authorization to utilize the experience you've had here in Washington with the Washington tribes, to use that in the training that you're going to be doing with the university public health system, so that there's a better understanding within the public health system wherever we are. We can make a difference. So that's my challenge to you, and good luck, Heika.
Thank you, Marilyn.
Maria?
Hi, can you guys hear me?
Yes.
Well, hi, John.
Hi.
I don't want you guys to see me because, you know, I want to get through this without becoming a total fumbling idiot here. And hopefully get through with this without too many tears. Some of you may know that I was the first tribal liaison at the Department of Health when John joined the agency. And I want to congratulate you on your new position. Well, I'm sure you'll have a great time and you'll be a great professor. You know, I know this because you and I, one of the first things we took on was the agency's consultation policy. And that was a very humbling issue for me, a very humbling time for me, because I've never had anybody go line per line and check every word and edit it. And that's why I know you're going to be a heck of a great professor.
The students may not feel that way. We'll see.
Well, yeah, I will sympathize with them, yes. I also want to thank you, though, for the great work you've done to strengthen our relationship at that time, our agency relationship and partnership with our tribal nations. It was an amazing hurdle for us to take on and succeed in. And there were many things we did, John. You may recall that we not only did our consultation and policy procedures, but we really enhanced our emergency preparedness fireside chats. You came very open. We brought in the states of Oregon and Idaho. It became very collaborative. We accomplished much because of those discussions. You were there as we were talking about foundational health services, all our efforts on the other work that we did, the work that Janet and Cindy and all of them have now brought to fruition with the Pulling Together for Wellness. But on a personal basis, and from my heart, I want to thank you for the support and kindness that you shared with me and my family after my husband of 38 years passed away. I will always be thankful for your friendship, your understanding during this time. And knowing you, John, has been a real adventure. And wish you the best of luck, my friend.
Thank
Good
you,
luck.
Maria. Thank you.
Thanks, Maria. There's some comments in the questions box. I don't know if people want me to read them or if they want to unmute and say them to Secretary Weisman. Okay.
Vicki, this is Lou.
Oh, Lou, we skipped you. I'm sorry. Go ahead.
Thank you. John, I wanted to thank you for making us feel that our work is valued by truly listening and supporting the work with actions and with your leadership. Thank you for fostering the notion at the Department of Health that partnering with tribes and urbans is essential. And thank you for doing that with kindness and with caring. So just really want to wish the best for you and your husband. Take care.
Thank you, Lou.
Is there anyone else? And if not, I'll just read you some of these comments, John. I think it's hard to say goodbye sometimes. I bet you're still here for a little while, right?
Yes, I am.
Okay, let's see. So Ed Fox says, hi, I echo the contribution to the LGBTQ community. I know there have been heartbreaks in the past few years, but progress will be made in the next few years. And he also said that Casey Cooper, CEO at Cherokee Hospital, he's got his email for you, would be more than glad to meet North Carolina to talk about the impressive Indian health programs.
Great.
Barb Marsali from, it's not WACMAC anymore. But he says, thank you, Secretary Weisman, from all of Washington's community health centers. Best wishes. And Tony Lodge says, farewell, Secretary Weisman, you did good. You'll do even more in your powerful, arcing sphere of good work, Tony Lodge. And is that, I think that's it. Yeah, so thank you for coming and letting us make you really uncomfortable. It's part of going, I guess. And we did, hear from the governor today and about your replacement.
Yes.
So, yeah, so there'll be lots of work there for us because we're not sure he knows. If you're coming from Texas, my daughter lives in Dallas and she told me that people there think the Indians died and they're historical. So I'm a little, so we'll see how that goes.
We'll set them straight from the beginning.
Yeah. So, yeah, so really thank you. And I'll give you an opportunity if you wanted to say anything.
Let me just say something real quick if I can, John. I want to follow up on a little bit on what I think Ed said. If you can take your prospective students on a road trip to Cherokee, North Carolina, and you see how strong their culture is, how strong they are as an Indian community, and how many centuries they've persevered, it'll be awe-inspiring. The other thing that I would have to say is the way that they've put together their healthcare model there is something that if you've ever had a chance to sit down and talk to them about their facility and how they got their facility, and Cherokee got their facility, I think, and their mission and how they talk about their mission, it just takes your breath away. And it's a beautiful place to visit up in the Smoky Mountains too.
Great. Well, thanks, Steve. I'm going to make that a priority to go see that when I get out there in those first few months. I'm going to have some time where I'm actually not working, so I will put that on the list. To the elders, to the elected officials, to the staff, to my friends here, commission members, Vicky, I know you're sad that this is sort of remote, but this blanket is so incredibly powerful. And I feel you all just wrapped with your arms around me. And I think that's the power of this ceremony, is that this blanket really represents all of those relationships, all of those accomplishments we've made together, the times when you forgave me when I did mess up, and there was enough trust built that we could work through that. This blanket really represents all of that, and I feel you here with me. I'm very humbled by your words, your friendship, your guidance, your teaching of me has been remarkable. I've always been so impressed with the patience you all show for us. Marilyn, I mean, you know, to co-chair with a county commissioner and myself, that policy group was incredible. And all the times you all have sat through meetings on issues that maybe weren't directly applicable to you, your patience, the honor you gave folks is so remarkable, and something that I take away with me, and that I hope all of us in return do with you. And I'm proud of the accomplishments we've made together, and you guys have outlined them in terms of the pieces of getting things in statute and really seeing the public health system as the four legs of the stool, with the tribes, with the Board of Health, local health, and state health, has been remarkable. And I'm always impressed by what we can accomplish together. And that road hasn't always been easy. I do remember that meeting of the Foundational Public Health Services very clearly, where literally, you know, you all took the seat at the table. And that was an incredibly powerful moment. And I'm pleased to see that it's turned into a lot of fruit along the way. And your friendships, the things you've taught with me, will never go away. I will call upon some of you to either come teach or join in a video with us class. And certainly, if you're in North Carolina, I really want you to look me up and have us connect there as well. Again, I'm humbled. I feel you with this blanket, and thank you. Every time I look at this, I will remember you all and how you took a chance on me as a new secretary and gave me the chance to engage. And I appreciate that opportunity. And the new secretary, Umair Shah, is an amazing human being. I've known him for a decade or more, and he will bring the same kind of values, openness to his role. And I'm looking forward to seeing what you all accomplish together, how you take what we have built together and really capitalize on those opportunities that are out there, and where this will go. So I will be watching from North Carolina, and I look forward to my visits back here. And who knows, maybe I'll end up back here after my stint out there. So, and to, you know, Maria, and to Cheryl Lowe, and to Tamara, who have served as the tribal liaisons in the Department of Health. Your guidance has been incredibly important to me. Your support, your wisdom, the work that you do on behalf of state government in working with the tribal governments is incredible. And those aren't always easy things for us to do, and there's so many moving pieces. You each in your own ways really made that job special, and the work that you did special. So we are all a team, and I really appreciate that support. And to the commission, thank you for what you do. The work, as you know, health and wellness is incredibly important, and the work around the pulling together for wellness is so important. It just embodies all of what we would want, bringing culture and tradition and science and data together for the way forward in supporting people's health. So thank you again for everything you've taught me, for your friendship, I'm incredibly grateful, and I look forward to us continuing these relationships into the future. So I raise my hands to all of you. Thank you.
Thank you, Secretary Wiseman. I think, is any other comments? I see one more thing in the chat, and I'll read it. Oh, wait, is that my hand? I'm really bad at this, Lou, come on.
We've got one comment from Jason.
Okay, Jason, did you want me to read this or do you want to read it? Is he unmuted, Lou? Where'd he go?
Jason?
Oh, I think I am unmuted now, Vicki. Oh, I didn't mean for, John, just wanted to emphasize how we're going to miss you from the state team as well. And I remember in a cabinet meeting where you're just such a strong leader in setting tone and vision. And I remember how impressed I was when you emphasized early on in a cabinet meeting how impressed you were working with the commission and some of the tribal leaders. And you really set that tone for the cabinet, and I think had helped with the health cabinet folks going forward. I think we're still fostering that and building on that. So I just really wanted to emphasize that, and you know I'll miss you, man. I love you.
Back at you, Jason. We've been through a lot.
Thank you, Jason. And thank you. Yeah, just wish you safe travels. I know you're not leaving yet, so we'll probably still be having meetings, but we really needed to do this. You know, it's important for us to honor you, and we will miss you.
Thank you.
Thank you. And I know that you've got a lot going on, so I understand.
I'm going to stick around a while, but I'm going to put my camera off so that you don't see me eating.
Thank you. So I don't know if everybody saw this yet. There was a press conference. Here's the press release for the incoming Secretary of Health. Molly Boris from the governor's office did reach out to me and said that we will be hearing from from Dr. Shaw, and that we'll be making those connections as we did with John before, and helping him know about how we work together here in Washington State. I'm sure that might be different from what he's used to. Again, sorry to bash Texas, but I'm sure there are lots of nice people in Texas, but I think it'll be interesting anyways. So Steve, did Nancy use your hand up again? Oh no, that's from before. Okay. Steve, did you have anything else before we move on?
No, but I will tell a little story. I've told some others this. The first time I met John, I was I think I was chair of the public health nursing directors, and we were trying to get you know, it's kind of like sometimes the American Indian Health Commission meeting, you know, we're trying to get all our delegates there, and we'd been trying to get the nursing director from Pierce County to come there, but only about the third largest city in the state or something like that maybe, and they weren't coming, and then all of a sudden, and I think that meeting might have been at Sun Mountain. I can't remember, John. I think it was at Sun Mountain up there by north of Chelan, I think. Anyway, John showed up representing public health nursing, And, you know, and I was kind of wondering, so, you know, what's the deal with the nurses in Pierce County? But anyway, that was my first meeting of John a lot of years ago, and he did a pretty good job of representing the nurses. I don't know that we ever did see anybody come there from Pierce County though, John. Thanks.
I forgot about that.
Oh, thanks, Steve. So if we're okay to move on, I hope everybody knows that we had set this time aside to do our Centennial Accord preparation, which really is looking at the work that we did last year, you know, what the issues were and what we're going to do this next year, which is appropriate ending to our summit, because that's what the summit has been about, looking at really the last 2 years and how we're going to go forward in the next year. What are the areas we're going to focus on? I put together some very limited slides because I had power outage this morning and my computer froze, but just to kind of help us go along. And I asked Heather because I think it's important that we start this with remembering why we have the Centennial Accord and what the relationship is. So Heather, are you ready?
I am, yes.
Thank you.
Yeah.
And this is actually part of our behavioral health presentation, but it applies across the board.
Okay.
Heather.
Hey,
Yeah.
I just had a quick question though.
Sure.
Is John going to be at the Centennial Accord, or who's going to be representing Department of Health at the Centennial Accord on the presentation?
I think, remind me when I think it's in my calendar.
It's Thursday.
Thursday.
Yes, I think so. There are a couple of other things, but I believe I'm there, right, Tamara?
That's right, John.
Good, all right.
Just checking. Okay, thanks.
All right. Okay, so some of you may have been at one of the breakout sessions yesterday on tribal-centric behavioral health, and we started off the presentation just getting back to fundamental principles in Indian law and talking about tribal jurisdiction and authority. So this slide really is, you know, there's buzzwords in here about behavioral health, but it could apply to really any area or subject matter in which a tribal nation is providing for their members or providing services on tribal land. So tribes possess the inherent sovereign authority to provide behavioral health services. That could be public health services for their community members, including but not limited to, and we mentioned preventative services, inpatient treatment, and involuntary commitment proceedings through their tribal courts. And again, we focus always on that word inherent. Tribal sovereignty is not something that was given to the tribes from the federal government, and is something that tribes have possessed since time immemorial. And a few important case law, well, there's quite a bit of case law on this, as you can imagine, from the US Supreme Court dating well back to Chief Justice Marshall in the 1800s. But when we're talking about tribes, tribal authority to pass laws, to implement regulations, you can see quite a bit of case law on that specific issue, and so that's why you see this case from the 1990s. But this concept again goes way back to the 1800s, that tribal nations have inherent sovereign authority over both their members and their territory, and that includes the power to regulate their internal and social relations. And oftentimes, this issue about the issue of tribal authority and Public Law 280 gets confused and muddled, and particularly in Washington State, because the PL 280 statute, RCW, is very poorly written, quite frankly, from the 1950s, and so you can forgive one for maybe misconstruing the state's jurisdiction, but oftentimes we'll hear from maybe or from a state employee or staff member, maybe some misinformation about the extent of jurisdiction that a state might have over a tribal matter. And so we're working at the commission to do some more presentations and trainings on this issue. And it can take, it's probably a good 3-hour session, but just to give some basic principles in just 1 minute instead of 3 hours, we thought would be a little bit better. So for the first principle to remember when it comes to Public Law 280, that Public Law 280 does not remove a tribe's sovereign authority. So even though a tribe might be what we call Public Law 280 tribe, in other words, they didn't enter into retrocession, that doesn't mean that their sovereign authority was eliminated. It simply means that there is shared jurisdiction with the state court and the tribal court. And it's only in specific areas, subject matters, and it gets really convoluted, and it depends on which tribe it is, it depends on what the subject matter is. But bottom line is, remember that Public Law 280 does not remove a tribe's sovereign authority. And then secondly, it does not grant authority to states to regulate civil activities in Indian country. So that could be any type of regulation, traffic regulations, public health regulations, etc. And Public Law 280 did not remove the criminal or civil jurisdiction of tribal courts. So remember I said earlier, it's a share. If there is Public Law 280 jurisdiction, it's shared. So a tribal court could hear the same issue and the state court could hear the same issue. We refer to that as concurrent jurisdiction. So those are the 3 important principles. And our Washington State Supreme Court has some pretty good, clear language, I think, on these distinctions that are laid out in our federal law. And in State v. Schmuck, that was a 1993 case, they restated that those principles from the federal case law, that there's nothing in Public Law 280 that removes tribal authority, because if so, that would mean that Congress intended a sweeping change in the status of tribal government, which clearly was not the intent. So just a few slides on those issues. I think that's the last one, and then you guys can delve into your next subject matter. Thanks.
Thank you, Heather. And I think those concepts are pretty foundational to a lot of the work we've been doing. So I pulled up last year's Centennial Accord talking points, and these are the issues that I found that we talked about. And gosh, it seems like it's been more than a year ago. But so addressing issues in the behavioral health crisis system, supportive funding for foundational public health services, opioid response, tribal data, Indian healthcare provider workforce development, and by that we mean the chat board, and then continue funding and coordination for tribal youth prevention programs, which this has been a tough year for that because of all the cuts. And then ensuring agencies are treating tribes as governments, which is why I asked Heather to give us that reminder of the tribal jurisdiction versus state jurisdiction, because I think it's something we keep rubbing up against, and I think it's where that point came from. So over the last 2 weeks, as we spread our summit out, we've tried to hit all of these topics in our different breakout sessions. So I just want to go through I just made some really basic slides, and I just really want to have a conversation about the work we accomplished, and then what are we looking for to accomplish in the next year, and think about what will, what we need to share at the Centennial Accord on Thursday. And it looks like, I think we have Mystique here, so she can correct me if I'm wrong. There's the work session recap is in the morning of Thursday between 10:45 and 11:45, and it's broken down into social services. Then we're going to talk about the Long-Term Support Services Act with the tribal opt-in language that we've talked about, and then health, and then natural resources, and then parks. So we're not last for once. Oh, Craig's here too. Thank you, Craig. And then in the afternoon is when the roundtable and the agency updates. So can we unmute you, Craig? Blue, you want to help me unmute Craig? Oh, he's unmute. Okay. I think you can unmute Craig. In the afternoon, we'll just, I know I attended the meeting on Friday, but I was really distracted. So the tribal leadership will be talking in the morning and the afternoon.
Yeah, can you hear me?
Yes, can, Greg. Thanks.
Yes, great. Yeah. Hello, everyone. I'll just provide a little update. We're updating the agenda here. We have a little more subject matter on what the 19th will look like in regards to timing. We do have about I think an hour and 15 minutes for that work session updates, and we have moved those up to occur right at like 10 o'clock. And so it's just going to be kind of rapid fire from that time to, again, do the work session updates and the like. So yeah, so as was stated, so social service, the long-term support, our Trust Act legislation, and then we'll go right into health from that. So yeah, so you guys are third up
okay.
on that morning conversation. The afternoon conversation. And so after that session of kind of, work session, action item updates, then we'll go into like a tribal leader dialogue at that time of just identifying priorities and action items. So from 11 to 11:15 to 12:30 or 12:20 will be kind of a tribal leader open roundtable just to discuss what the priorities are. This meeting, just given our short time frames, will just really be a working meeting, just to really identify, again, what priorities are, what action items, and what follow-up items, need to occur. And what the ongoing work is, I stated here, looking at the slide 19, a lot of these issues are carryover issues, or there might be a different component to that issue now. Addressing what's immediately in front of us as it relates to, coronavirus response, et cetera. Afternoon time, there will be some issue topics already sort of scheduled. We have DCYF scheduled right out the gate in the afternoon session. We got an update from Washington State Patrol on murder missing Indigenous women, and Superintendent Reichdahl OSPI update. And then we're just kind of adding topics as people identify them. At the same time, from tribal organizations, tribal leadership standpoint to, whatever they kind of want to, so that afternoon time will be kind of open and really kind of flexible and real fluid. And really just try to capture that time frame. Just so everyone knows, the morning time is when the governor will be participating. The governor, so 9 to 12:30 is when the governor will be on participating in the meeting. In the afternoon time, the governor will not be there, but agency reps and different gov staff will be a part of that.
Okay. Thank you, Craig. That was really helpful. Any questions? Looks like Charlene Nelson has to leave. I know they're having bad weather down there. I hope you guys are all safe. Okay, so I'm just going to go through and kind of talk about some of the things that we've accomplished, and I'll be calling on some of the other consultants to talk about. And again, you know, we had our breakout sessions. The videos are posted on the website now, and we're getting the documents and materials, the PowerPoints up on there as well. So if you missed anything, as I told Kim Thompson, if you're bored, you can go through and watch some videos and see what we did this last year. The biggest thing was really the passage of the Indian Behavioral Health Act. And it kind of passed, you know, very quietly at the end of March, right after the stay-at-home order. And then we were all very busy, so we really didn't get a chance to start implementing pieces of the act until middle of summer, I would say. So as many of you know, this work has been going on for decades, since the implementation of the regional support networks and tribes working with DSHS then, and now Healthcare Authority trying to work on some access barriers. Under the 1115 waivers and the 1915B waivers that for Healthier Washington to integrate behavioral health with physical health, well, first integrating mental health with SUD services, and then with physical health services. There was a lot of issues that we worked through, and then what was left went into this bill. So under the Act, it requires tribal court orders for involuntary treatment are recognized and honored. It allows tribes to file and or intervene with ITA court proceedings. It requires notification of Indian healthcare providers of any involuntary treatment admissions proceedings for tribal members or citizens. It allows Indian healthcare providers and tribal courts to receive mental health records. And the big one that we're working on right now is that it establishes a tribal designated crisis responder, and that's the new word for designated mental health person or county designated mental health person, depending on how far back you go into this work. And they will be appointed through a process with the Healthcare Authority and the tribe or tribes, and then they will be paid by the Healthcare Authority through, and when I say by the Healthcare Authority, the funds come from the Healthcare Authority. I think in the beginning they might have to come through a BHASO because of the way that the budget has worked, but that is still in process. So this is a lot of things that we're really excited about moving forward. So we will continue this work. We've had some things come up through behavioral health that we've got several roundtables and consultations going on with healthcare authorities. So we will be seeing, working through those problems. But for this work, we hope to be reaching out to different tribes and working through with the development of behavioral health codes and doing some trainings about having a tribal DCR at your tribe, how that will work with the urban programs. Because I think for the urban programs, the DCR would still probably have to be employed through the BHASO, but they could be a tribal DCR. So there's, you know, that possibility. So this is a big project that we'll be continuing to work with the Healthcare Authority on implementing, and with you all at the same time. So I don't know if there's any questions or comments. And Lou, is everybody unmuted and they just are self-muted? And I don't want to, or do you want people to raise their hands if they want to talk?
There's quite a few people unmuted, but if you're unable to unmute yourself, just quickly write something into the chat box and we'll make sure that we take care of that.
Okay. So I think this work is going along, and it's worth mentioning at the Accord as, I mean, not perfect, but we're getting somewhere where we've, really struggled in the last couple of decades with behavioral health crisis work. There will be a tribal crisis coordination hub that we're working with Volunteers of America to stand up. We're looking for a tribal crisis coordinator to work there and to help us work through helping with the recognition of court orders, with helping with the connection between tribes and different providers, non-tribal providers who might have American Indians, Alaska Natives as patients, who maybe even helping coordinate with the tribal DCRs. Any questions or comments about that, or thoughts on what the work for the next couple years might look like? One of the things that we talked about in this breakout session is that we haven't really addressed juvenile services, and that's probably something that's going to need to happen in the next few years, and it'll probably happen, I think, in coordination with the with IPAC or the Social Services Tribal Leaders Committee. I think they have a piece in that too. So I don't know if there's thoughts or comments on that.
Yeah, this is Steve. I don't know whether you whether it encompasses it all, but it probably does. But the other place that sometimes you need to use court orders is for detox, medical detox, and that's kind of it's really kind of separate, even though it's all linked together. So I don't know if we need to especially call that out, but that's another place where you sometimes need to do it.
Mm-hmm. And Heather and Catherine, actually, just Catherine, is that something that's in the behavioral health codes? I mean, we're still developing the templates for those for tribes to look at and adopt as they need.
I think that's right.
Okay, we'll make sure, Steve. I know that's part of the work of a DCR and part of the training that they get. And then also some other work we're doing is we've developed a training about the Indian healthcare delivery system, behavioral health services, and working, trauma-informed care and American Indians, Alaska Natives. And we will be doing some trainings for the non-tribal DCRs through funding from the Healthcare Authority. And then again, we'll be doing some trainings for tribes interested in having a tribal DCR appointed. No questions or comments?
Vicki, this is Marilyn.
Hi, Marilyn.
I just wanted to add to the conversation, and I don't want to let it slide by within the priorities that we're needing for the coming 2 years, is the recognition of with COVID-19 and increased need for behavioral health services, increased access, and support the MAT programs that many of our tribes do have in place, and the model that Swinomish has with the wraparound medical behavioral health services available to the Medicaid population, tribal as well as non-tribal, and the other tribes that are looking to stand up the MAT programs in communities around the state to provide access, increased access to the low-income population in the state. And but there was a mention of the need for coordination in crisis services for the the medical detox and the mental health stabilization in some cases where we have long-term community members that may have been in long-term recovery but have had trouble during the COVID-19 with being overwhelmed with the stress in their life, and just needing to have that support network available to them, whether it's medical detox, whether it's other behavioral health services to help stabilize their crisis situations that they're facing. But we have the Swinomish tribe that's expanding their wellness program and to provide recovery housing as well as detox services. And so we have tribes that are developing these additional support systems, and they may have received funding to build these facilities, but are now looking at the need for operation expenses. Once they get these programs built, the facilities built, then ongoing operation and the staff that's needed to meet the needs of the population from a cultural perspective. So that's kind of on the horizon. We need to be looking at how we can get the support for those programs that are getting developed around the state. And the work that we're doing with the Behavioral Health Advisory Work Group in establishing the evaluation treatment facility that would serve American Indians, Alaska Native population in the state. We need to get additional tribes involved in that work that we're doing and serving on the advisory group. So I couldn't let the opportunity pass without bringing those issues up. Thank you.
Thank you, Marilyn. I really appreciate that. Yes, we do have the Tribal-Centric Behavioral Health Advisory Board that we've been working to really establish, and it needs members from at least the different regions across the state. And then we're also working on having the regional subcommittees of that advisory boards, so that if there is an opportunity again, which we had and weren't able to do anything about, to either purchase land, take over a facility, and have that evaluation and treatment facility, there needs to be the governing board, and that would be the Tribal-Centric Behavioral Health Advisory Board. And that is above and beyond, as you said, what different tribes across the state are doing. There's all kinds of really creative, innovative things going on across the state, and we're also supporting those through this work. And then a comment from Francesca Mernon from Seattle Indian Health Board. Seattle Indian Health Board is looking forward to identifying how the tribal DCR process can be modified for urban Indian health programs. And Francesca, I'm thinking, I'm trying to type while I'm talking to you. I'm thinking maybe we can do a separate meeting with both Seattle Indian Health Board and Native Project, and really kind of go through those slides that talk about what the process looks like at your individual organizations, and see what we can develop from there. Because I think we all know that it's important to have the assessments done by people who understand the people they are providing services to, and also the system of care that's available to that person. So I think that would be really important for this next year. So that's on my list. Tony and Dylan, I'm hoping you're good with that.
Yeah, this is Steve. Just thinking, have things really changed a lot since we've gone from RSNs to BSOs now to they're called something else. I don't know, are they ASOs now or whatever they are?
BHASOs.
Yeah.
They just needed some more letters.
Yeah, I don't know. It gets to be an alphabet soup, but you know, it's probably the same systems in place, just the names change, and many times the personnel didn't even change, just the names probably, right?
Right, yeah. And so, you know, Steve, we did that survey, not this summer, but summer of 2019, that included how things were going with the BHOs. And now that it's the BHASOs, we have those performance measures that we've suggested, recommended for the state. That's the roundtables and the consultation that are November 24th, December 7th, and December 15th is the consultation. That will include talking about those performance measures and getting them in place, and also some of the issues that the residential treatment facilities are having. Any other thoughts or comments?
Yeah, Vicki, this is Nancy. Just
Hey,
briefly. I just wanted to speak again to the issue that you brought up regarding looking at in the next biennium, looking at increasing awareness and services around youth and the severe need for youth to be recognized, you know, within the behavioral health system. I think all of us are cognizant of the fact that our need for behavioral health doesn't begin at adulthood. And often, you know, there are really strong-rooted, strong root to their youth. And I really believe that if we really continue to look at you know, servicing our youth that are exhibiting behavioral health needs as early as possible, when they become adults, they are not so entrenched in that behavior and the need for alternative pain medication, for lack of a better word, that self-medication to really make a difference in the system. I'm so totally convinced that, you know, we can intervene at an earlier age, at an earlier stage, but the system is not in place to really address it in a good way, in a holistic way. And I hope that in the next biennium, we really carve out some time to look at the fractured youth system that is fractured because of a lot of reasons, but you know, it's inclusive of the foster care system, it's inclusive of the education system and the dropout rates and the runaways, the street youth. I mean, it is a huge bite to take, but it's a critical bite to take. And I just can't say enough about the need to really look at that in a good way and moving forward on that. And you know, I would be willing to volunteer or do anything to assist that to move forward.
Thank you, Nancy. And we really value your wisdom in that. So, you know, when you say you'll volunteer, we're going to be circling back.
I don't often volunteer anymore because I know what that means, but this has my heart and this has my commitment. So I don't say that lightly. I say that with sheer determination and and a good way of offering anything that I can do, even, you know, if it is just the questions which are critical. I am at your service. Our kids deserve that. Thank you.
I agree. And the behavioral health work is really something that drew me to this job, and especially, you know, how impacted our youth can be. Any
Vicki,
other?
this is Jan Olmsted.
Hi, Jan.
Hi. I thank you so much, Nancy, for raising awareness about that. And I think that this is one of the key things that you said is, you know, about that, you know, we approach things from a more holistic point of view. And I think that there's where, you know, again, that pulling together for wellness framework that was guided by the tribal leaders across the state really put their wisdom to that thinking. And so, you know, one of the things that has been part of our public health discussions really has been about how we need to have a framework, excuse me, pulling together for wellness framework, a tribal framework put into statute that acknowledge the impacts of historical and intergenerational trauma and the relationship to, you know, the adverse childhood experiences and that study, the results of that study, the relationship from historical intergenerational trauma and ACEs being an outcome of that trauma that is intergenerational. And so that is a policy issue from my perspective, that it's not there in statute. And we certainly have the evidence that is developed from Native scholars, from Vine Deloria to more contemporary people like Katrina Walters and Maria Yellowhorse Braveheart. So I just wanted to share that point, and then I'm going to just share with the group some of the things that have been raised in the public health sessions over the last couple of weeks. Support for the generational clarity training that is certainly part of addressing that historical and intergenerational trauma. And then in the suicide prevention session, some of the recommendations that came up out of that presentation were support for resources for tribal and American Indian, Alaska Native community culturally relevant suicide prevention, intervention, treatment, and postvention. Reconvening of a statewide suicide prevention intertribal work group, support for the annual intertribal youth suicide prevention that focuses on wellness from a strength-based perspective, and then also support for American Indians, Alaska Natives, veterans, suicide prevention. That's not work that we've done thus far, but that's something that certainly has come up over the last few years. And then in the area of maternal, infant, and early childhood health and wellness, advocacy for tribally driven and culturally designed home visiting programs. And, you know, we've been engaged in that work with DCYF. We know that some tribes are funded to implement home visiting programs, but there are obstacles to tribes implementing them. They're very expensive, and there's a lot more work to do there. So, you know, there's been another conversation about how to approach it perhaps in a different way through the development of a reimbursable MIH provider type. And so that's been, I think it came up in the Tribal and State Leaders Health Summit 2 years ago. And again, it came up in our session yesterday. And then additionally support, oh, sorry.
And Jan, that was maternal infant health. Was it a community health aid that's
Well,
specific
and
to maternal health?
that's part of the conversation that
Yeah.
needs to be, yeah. So there's more work to do there, but I just feel compelled to bring it up to this group while we have the attention of everyone. So, and then the support for postpartum Medicaid coverage, and that was legislation that came up last year, and so there's and the American Indian Health Commission did support that legislation. It was not passed. It may have been vetoed because
it was passed, and then the governor vetoed it because of the budget. Yeah.
And then just
Too
two more
sad.
things, and they're having to do with anti-racist policies, and it's vaping and commercial tobacco prevention and non-criminal enforcement, anything that comes up in the legislature this session having to do with that because of the youth possession issues around the passage of the Tobacco 21, which was great legislation, but there's certainly some concerns there about detainment of youth of color or LGBT youth that has come up in multiple conversations. And then also support for commercial tobacco prevention funding to address inequities that have been longstanding, pervasive in our communities. Thank you.
Thank you, Jan. And that just goes to show how everything's connected that we do, because that is connected to this work. It's connected to much of the public health work. And we're really trying to make those connections and work together. I think for because of how funding works through the different agencies and places we get funded, everything gets siloed, but we're really making this very concerted effort to be tribally driven and look at this in the whole person, whole community view, and trying to bring all those bodies to work together so that we're complementing each other. And it's hard to break those habits. So thanks, Jan.
You're welcome.
And speaking of trying to connect all those dots, another issue from last year was the support of the funding for the Foundational Public Health Services. And boy, you know, hindsight. So the request to fully fund Foundational Public Health Services, not just the tribal piece, but for the whole state, it started at $495 million, I think. The Foundational Public Health Services Steering Committee kind of got the ask down to 296 million to really, you know, get going on it. And what was funded was 22 million. And so I don't know if there had been different view of funding, if that would have had any impact on our COVID response. But that's one thing, is supporting the governor and the legislators really think about fully funding foundational public health services. And then also we are working on the funding for tribal foundational public health services. And so that work will continue, looking at the programs at tribes, looking at which ones are foundational, looking at gaps and capacity and capabilities that are needed to fully fund those services. So that's definitely work we're doing in the next, well, I hope we're getting that completed in the next year so we can start asking for money for the tribes to help fully fund those programs. But also hoping to support the bigger ask for the whole state, because we know that being a part of the public health system, the tribes and the urban programs, Indian healthcare providers, that the stronger each each separate piece of the system is, the stronger we all are together and better able to handle a crisis like we've had this last year. As I said, I had some troubles with my computer shutting down. I know I need to buy a new one, but it's like more than my brain can handle right now. I did have some slides, but they're not there anymore. So any thoughts or comments about that? Is that's still a priority in my mind?
Yeah,
What are other,
just
oh,
one
go ahead,
thing
Steve.
that we need to add to the list, and that is funding to support the gathering of the epi data and the stuff that
Oh,
the epi
yes.
for us.
Yes, funding. And this will cross over into the slide that we have about the tribal data sovereignty, but there is, you know, work that both Urban Indian Health Institute and the Northwest Tribal Epidemiology Center at the Northwest Portland Area Indian Health Board are doing to support this work too. And we need to make sure that they continue to be funded and are at to the table with the state epidemiologists so that that work is better coordinated. Thank you, Steve. Any other thoughts or comments on the foundational public health services? And I just want to add that for our annual meeting on December 2nd for the commission delegates, we'll have our priorities. We'll get the priorities out to you the week before and some briefing papers. The briefing papers are going to look a lot different than you're used to because we're incorporating the Pulling Together for Wellness framework into the briefing papers, so they will fit into those values. And Jan, do you want to maybe talk a little bit more about that? And we're really excited about that because I think that's going to help us really make the work fit with what the work that goes on at tribes, at urban programs.
Yes,
Sorry.
and I guess that I also think that it by using a format that really aligns with some of those vision and value statements creates a pathway that again speaks to starting from a tribally driven framework. Because those were created by tribal leaders, elders, youth, some of you that have put time into it too. So I'm thinking that we're creating a pathway here, and that we are really operationalizing those vision and value statements.
Thanks, Jan. Any other thoughts on foundational public health services? Okay. And so we kind of covered this, but tribal youth prevention programs. And for the commission, that the funding we get, and maybe I think many of you get funding too through DOH, but there's also the what are they called now? The Indian Nation agreements, and I think there's some prevention funding through there. And I think really looking at, again, not those, I know it's hard because the different grants have different requirements, reporting requirements, but how to make a whole program out of the different funding streams and really weave the prevention work together. So Jan, we have had marijuana funds, tobacco funds. What's the other one I'm missing?
So one of the ways that we certainly have done that by supporting youth activities that have been around leadership. Mm-hmm. and looking at this from a strength-based perspective, by hearing from youth in terms of the challenges that they face, also acknowledging what youth have told us is having that relationship with adults and elders is really important to them. And so that's how we have shaped some of our planning around our activities. For instance, with the Youth Suicide Prevention Summit was a combination of many things that could be looked at as wellness activities as well. Youth have made it clear that culture is incredibly important to them. It makes them feel strong, and they like to engage in those activities with elders. Many of our sessions were actually led by elders and doing and engaging in cultural activities with youth at that event. Certainly a lot of content around the actual issues of suicide and dealing with peer-to-peer conversations and prevention. But we're also weaving in these other things. The same, and another example is vaccination and our vaccine materials, and even some educational engagement activities with youth have taken place at the Youth Suicide Prevention Summit, and also at the Canoe Journey and other individual community events that we've sponsored for individual tribes. So we have been working towards bringing all of these things together from more strength-based perspective.
Thank you. Sorry, Marilyn, I think you can unmute yourself now. And I don't know if you want to go back a slide. Marilyn, was it Marilyn that was?
Vicki,
Yeah, sorry.
I just wanted to ask a question about the priorities that you're putting together for tomorrow, but also attempting to identify how we are going to link the priorities of the work of the commission with the governor's Tribal Health Council. And I think we have an annual meeting scheduled at the beginning of December. I don't remember if it's before our commission meeting, annual meeting, or when that health council meeting is.
It's the day before. It's on September, sorry. December 1st, and I think it's in the afternoon, and then our meeting will be on December 2nd. And I really need to coordinate with the Office of Tribal Affairs and the other tribal liaisons on that. I know one of the things that a couple of things we were focusing on for Governor's Indian Health Advisory Council was really legislation, the tribal representation on the Emergency Management Council, and I don't know if Francesca left, but we had talked about the having Abigail Echo Hawk talk about the missing and murdered Indigenous women and girls. Yes, Jesse says December 1 to 4. Thank you, Jesse. So I was thinking that was more legislative priorities, unless there's, I mean, it's your guys' meeting if there's other things you want to talk about. I know there's a lot of meetings happening right now, and we're trying to make them all coordinate and be valid. So from the summit and the Centennial Core talking points, we're really hoping to develop our priorities for the next 2 years, the Commission's priorities for working for the tribes and urban programs in Washington State. And then again, really looking at those legislative priorities and moving those forward too. Did that answer your question, Marilyn?
Well, I know that some of the issues that we have, that challenges that we have going on now with the behavioral health and the managed care and the Medicaid transformation waiver, some of those cross-cutting issues that we have may take some legislation
as well, but we don't really know until we finish the consultation process. And so, but the other thing that we need to put on the radar with the legislation is the report that's going back to the legislature on the long-term care, the legislation for implementation of that premium program.
And that we are going to give an update during the Centennial Accord on Thursday. And then I think that should come back to the Governor's Indian Health Advisory Council for discussion. I know that, you know, there's not a place that really fits for having that conversation best. I think Centennial Accord will hopefully give us input from tribal leadership on that. And it's just opt-in language, so I hope that it's a pretty easy discussion, but you never know.
Well, I think that one of the things we may be able to just have it on our list of items from when we present the issues, but refer to scheduling a meeting, you know, scheduling a time with the Tribal Leaders Association or, you know, the gaming, Tribal Gaming Commission, where we can get some agenda time coordinated. Deborah Leekenoff and Ron to just have the opportunity to present to the leadership about the opportunity and the involvement that our staff have had in the existing development of the report back to the legislature.
And I am in communication with Deborah Leekenoff about presenting to the Association of Washington Tribes. She wasn't sure. She was trying, you know how it is, to try and coordinate the schedule of the tribal leaders. So I think she's in the process, and as soon as I can get a date from her, we'll make sure that we're doing that. Jesse, I think I unmuted you. I hope I didn't mute you again. Did you have something to add?
You got me unmuted. Thank you.
Okay, thanks.
So we were just talking internally here at Office of Tribal Affairs about the agenda for the GHAC meeting on December 1st, and we were talking about the LTSS Trust Act amendment. And really, I think the intention there was to have a resolution that the Governor's Indian Health Advisory Council can vote on in support of the draft bill, because
great idea.
The bill is not coming to the legislature as agency request legislation because of the deadline. This whole issue popped up before or after the deadline. So that's what we did with the Senate Bill 6259, and so the idea was to try to use that again at this upcoming meeting.
That's a great idea, Jesse. Thank you.
And then some other topics we've been talking about are data. So I believe we've secured some time for, it's been a long day, for Adrian at Urban Indian Health Institute to present on data sovereignty during the Governor's Indian Health Advisory Council. I think we have some time, like from 3 to 4. So that was something that seemed like cross-agency, may require legislation, big picture. And then we're also thinking about just giving a short update on managed care, on Medicaid and managed care, just because we talked about it in the December 2019 meeting. And so just sharing those briefing papers and then just sort of giving an update on, where we are at this point. And then we're trying to figure out another big issue topic that either requires legislation or that involves multiple agencies. And so, Vicki, we're going to reach out to you and try to schedule a meeting to get all this figured out.
Okay, I am available Friday and in a couple weeks, I think. No, I know it's a little crazy this week, but okay.
Yeah.
So for the data sovereignty, is that in conjunction with the missing and murdered Indigenous women, girls, or is that a separate topic? So I would want to pull Lou into that with, if it's separate, into what the work that she's doing with the DOH and the COVID response.
Yeah, I think it could be a separate topic.
Okay.
We internally had forgotten about the missing and murdered Indigenous women and girls. So that might be our remaining topic. I mean, that's a cross-agency, may require legislative topic. So so that would make sense as the remaining topic to fill out the agenda.
Okay. I'm emailing Francesca right now because I think she had to leave. Okay, thank you. So for Governor's Indian Health Advisory Council, we'll hopefully have something soon. Maybe there's some time tomorrow. I don't know. Any other questions or comments? We were talking about the youth prevention programs. We kind of covered a lot of that already with the behavioral health, but there's other components of it, especially with the suicide prevention funding.
Vicki, this is Ann again. Oh, go ahead, Marilyn.
I just wanted to say that we cannot allow the opportunity to pass us by to bring forward the opportunity for tribes to participate in the discussion with the governor and the state on the COVID-19 vaccine distribution that's going to happen once it becomes available. We just need to make sure that, you know, tribal leaders are aware that the various opportunities, but we need to let them know also the state is prepared to include the tribes, but it's the tribes' authority to determine where they plan to participate in the vaccine once it becomes available.
Lou, anything to add to that? I know Lou's been working hard on the Thursday morning meetings.
Yes, as of right now, all of the tribes have made their decision as to whether they will be accessing vaccine from IHS or from the state. And we're working on actively getting all of the tribes that have chosen to go through the state to get the paperwork, the provider enrollment information in place. We just yesterday we had a roundtable that Tamara organized with the Department of Health team to talk about allocation at our next vaccine readiness meeting. We're going to talk a little bit more about the question about allocation. The work that's been done over the past few years between the tribes and the Washington State Department of Health around access to medical countermeasures and emergency vaccine is really, you know, providing a good foundation for this response. And so we've heard from the DOH staff about clearly supporting tribes in their determinations as to who their priority groups are and what the numbers are of their entire population and what the numbers are for their priority groups. And so the work has been ongoing, and we really look forward to keeping it ongoing through this whole time, before, during, and after the vaccine becomes available.
Thank you, Lou. But Marilyn, I agree that definitely is a talking point for Thursday. We're kind of going all over the place, but I assure you in the end, we will have covered everything as we always do. Any other thoughts on tribal youth prevention programs? I mentioned this, but we've been, I've been talking to Lucy Mendoza in Office of Tribal Affairs because she is familiar with the prevention funds, and really kind of looking about how to do that cross-agency work and weaving together prevention funds to continue to do the statewide work, host the Youth Suicide Prevention Summit, which we didn't have this year because of COVID and because of lack of funding, but also to do the work to help support communities developing their toolkits to help community members be able to talk to each other about suicide in an appropriate and safe way. So I think that will be really important work this year that will turn into, getting the funding is the work this year, into getting the programs going in the next few years.
Vicki, I just want to add something there, and this is from my experience in being involved with the youth groups in planning the Youth Suicide Prevention Summit. The things that come up for them are one of the highest priorities is about relationships, and it's relationships with each other. It's not, it's all different types of relationships. And I find that really interesting. So, work around developing healthy relationships, how, in that peer-to-peer prevention work, but also intergenerational relationships. So I just wanted to share that.
Thank you. Any other thoughts or comments? I just wanted to, I got the right PowerPoint up now. I just wanted to share, this was the visual that Crystal Tetrick from Kaufman Associates helped develop for the tribal public health services and thinking about foundational public health services. Let's see, okay, so youth prevention and then tribal data sovereignty, Lou. I have 3 slides, the issues, the work done, and the work ahead. So tribal data sovereignty is an ongoing issue that will be on our list for a long time because there is a lot of work around it. The analogy that Heather always uses is, I believe, taking a bite out of the elephant. So we don't have to eat the elephant at the whole time, but we need to take some bites and start addressing some things. And COVID definitely made some of our work more focused, work we were going to be doing anyways. But we were able to really focus it on COVID and the data around testing to really start to figure out how to coordinate better with the state. Lou, do you have any comments you want to make?
Well, just a little bit about the work ahead and the conversation that we had at the breakout session and that we've had with the data sovereignty work group that's been meeting to talk about the access to data in the state health information databases. We're kind of looking at two areas to really focus the work on. One of them is to expand the access that tribes and urban Indian health programs have to those existing state data systems and to engage with the state agency staff that manage those systems to make sure that those systems are respectful of data sovereignty and that they are supportive of the needs of the tribes and the urban Indian health programs. At the same time, we want to look at strengthening tribal health information management capabilities and strengthening the infrastructure within tribes and urban Indian health programs to be able to properly manage, store, and analyze and use the data that's available to them. So we're looking for, continuing to look for resources to invest in information systems, technology, in infrastructure, and in workforce development to strengthen the tribal and urban Indian public health or population health data management capabilities, and also to develop and strengthen legal mechanisms and policies and procedures that will protect tribal data in those information systems that are non-tribal, like state and other governmental agencies, as well as in the tribal information systems.
Thanks, Lou. And again, this is one of those things where we're kind of chasing funding through different opportunities. And I think part of the solution might be looking across a couple agencies to really pull together funding to support the tribes to be able to, as Lou put it, manage, store, and utilize data that is available to them. So that's our work for the next couple years. And there's some opportunities with Foundational Public Health Services funding. I know that the Healthcare Authority has maybe had some ideas about some of this, and not to confuse this with the electronic health records work, because it's a little bit different and that's a whole nother body of work we're doing. This is really about working within the other systems in the state where data is collected. I was pretty surprised to learn about how Department of Health data is collected and used at our, I think it was our 2018 summit. It was almost a little overwhelming to think of all the different data sets they have and what they use them for. So again, I think this is a lot of work that's going to be ongoing for quite a while. Any thoughts or comments on this? Anything that we need to bring to the level of the governor, talking to the governor on Thursday about, and in my mind, it's that figuring out how to fund across more than one agency to get this work done. Lou, do you have any thoughts?
On the funding piece specifically?
just on what might need to be brought to the level of talking to the governor about it.
So I think the issue of resources is really key, because there's a great need for infrastructure, for workforce, and for other resources to support tribes and urbans in being able to increase the capabilities within their systems. So I think support for, probably through the Tribal Foundational Public Health Services funding, so that it can reach each of the tribes and each of the urbans within its own system, in strengthening within them.
Thank you. Anybody else have thoughts about that? Okay. Oh, bad typo. Indian health care provider workforce development, CHAP and other providers. Cindy, do you want to talk about some of the outcomes from the CHAP conversation? I don't know this. So, you know, we're really coordinating this work through the work that the Northwest Portland Area Indian Health Board is doing, and we had Sue Stewart and Christina Peters help put together the slides and talk through what they're doing, and then really looking at what needs to happen in Washington State to implement community health aids, behavioral health aids, which was part of the Indian Behavioral Health Bill. And finally, the DHATs. There might need to be legislation, Washington State legislation. And so, Cindy, are you able to unmute? Is she there? Maybe she stepped away. So I'll go on and come back to that one. And
Vicki,
then,
this is Andrew.
Oh, Andrew, thank you.
So yeah, that's, and you know, the piece along with our mid-levels and the CHAP work is that making sure that we're working with the state and our federal partners so that work is reimbursed, and that's what we've run into with the DHATs. And the state stepped in with some funding, and we're very appreciative of that, but really it's up to our federal funding, our federal partners to fund that work.
And I think, I know that there's, Jesse, I think a state plan amendment in our near future for the behavioral health aids. Part of the reason we're talking about state legislation, and Francesca is still here, is to make sure that the CHAPs are available for the urban Indian health programs as well. And those are providers who they can bill for their services for. So yes, Francesca, we will want to work with you on that as well. So that's definitely work in the next year or two. Is there a comment? Okay, and then so something from last year was ensuring agencies are treating tribes as governments, as a government. And this, I think, this really relates to a lot of the conversations around institutional racism that are happening across the country. And really I think we've learned in the last few years, and maybe more than that, that there are a lot of times when we're working with the state agencies and they say they can't do something, or the tribes can't do something, and they can't really say why. And when pushed, there is no regulation that really supports the reason why not. And you know, institutional racism isn't about people, it's about systems that are in place that we're all trained to protect. And some of that is that. And so I think sometimes when we're looking at Indian healthcare providers and the regulations, either around licensing them or paying them, a lot of times we get this strange pushback, and we're not looking at the federal rules, and we're following them, we're not being treated as governments. They're just looking at them as providers. And so this has been really important work that we've really pushed a lot on this year. It's very uncomfortable work, let me tell you, but I think we're really getting there. You know, we had the behavioral health attestation that we requested that there be licensure for a tribal behavioral health agency if they went through the attestation process or the licensure process. And they still get the same piece of paper at the end, and I don't even know if you get a piece of paper still. And that really kind of brought this kind of bubbled it up to the top, where we're really looking at that, why this keeps happening, because it's been an issue, you know, with the integration of behavioral health services, with the mental health and SUD services. There was a lot of pushback from the BHOs or the RSN saying it's complicated. We don't think you guys know how complicated this is. And it's like, wow, it's our own people we're already serving. You don't think we know how complicated the services are? So this is something that we'll continue to work on. I don't think it's really a funded thing, but I just want to make sure it's out there and people are really understanding why we're pushing on some of these things that feel really uncomfortable. And it's okay to feel uncomfortable, because that's where we grow. I saw a hand raised and now I don't see it. Lou?
Oh, I just unmuted myself though.
Okay, thanks, Steve.
So I don't know if John is still on. Are you still on, John?
He had to go. No.
So this was so the collection of data was a topic at the State Board of Health meeting last week, and especially it was around the reportable conditions and also the coronavirus reporting, and so. The state and the EHR systems aren't set up to capture the information that they want to capture for marginalized communities, whether it's race, whether it's language that they speak, whether it's the different things. The databases just don't talk to each other on that. And so as they're putting together this plan to ask to do some things under reportable conditions, it looks like, you know, potentially, and so John Weisman was really supportive on working on this. And you know, so when we send all of our things to the lab and the lab reports and we report and the hospital reports, none of the databases are congruent with each other or talk or anything. And so there's some work that's going to have to be done. And what we do know is that probably IHS isn't going to do the work to make sure that our database is congruent with that. And especially now, the information that they're looking like they're going to want to collect on giving the corona vaccine to people, and the information they're going to want to collect. So I guess get ready for some fun times when we're in this in-between time now.
Yeah, and that gets to Marilyn's point too about conversations about the vaccine. It will be interesting, this transition away from John, and sometimes when you have somebody new and they don't know a lot, it's better to like start from scratch.
Well,
So-
I was looking through his CV and his history.
Mhm.
It's I don't even really think they recognize that there are a whole lot of tribes even in Texas.
Well, I don't know if you heard me earlier. My daughter lives near Dallas. She said that they think that all the Indians are dead and historical figures in her experience. So
Right. So hopefully, so is Charlene still on board?
Charlene had to go to.
Oh yeah, she was having a weather issue.
Yeah.
So I think that, we want to take our chances fairly early to have conversations with somebody who sounds, we have to take John at his Weisman at his words, where this person has a real good background, and but it doesn't look to me like he's probably worked with tribes unless it was urban Indians. And the because was he in Galveston, and then he was in Houston basically.
Yeah.
And then he was in the VA for a number of years, so he came up on Indian people in the VA. But anyway, okay.
Did you send a private eye?
What?
Okay. It sounded like.
No, I read through the stuff real quick that they had out on him.
Okay.
It was basically a short, kind of almost CV.
Okay, Cindy is back, so I'm just gonna go back to this. Oh, sorry. Was there a comment?
No, I was just gonna, I was just listening. This is Nancy. I was just listening to Steve's comments, and I concur 1,000% because I read his background as well. One of the things I was wondering is he going to be here with when John is still here? Is there an opportunity, and if not, would there be an opportunity to have the tribes meet with the incoming secretary and the outgoing secretary at the same time? Maybe a welcome and a goodbye and a passing of the torch process, so that we don't have to start from scratch, but we can start from the middle and move forward. If there's any kind of a possibility there, if John has the availability and commitment, and the new individual, I can't remember his name right now, would also do that transition, because this is a huge amount of work that we definitely don't want to start from scratch with.
Yes, very good point, Nancy. I spoke with Molly Voris from the governor's office this morning, and she was giving him Dr. Shaw my contact information so that we can coordinate a meeting with him and the tribes. But I like the idea of including John if we can, because I think that will be important for that continuity of the work.
Right. And the commitment that John had and also built, and that relationship that was so enriched under John's tenure.
Yes, thank you.
So the other issue around this data is they're talking about how they can get these strong reporting systems with the tribes in Washington State. But they're talking about reporting systems with the tribes in Washington State for the tribal members from tribes in Washington State. And we know that there are so many other Indian people here that are not a member of a tribe in Washington State, and their government is far distant. So we're going to have to do some work together as we're setting these systems in place, and they start reporting stuff down, and they start trying to find places of service for these people that are not affiliated with tribes in Washington State, to find a medical home or a place where they can come and get cared for. So that is another thing that came out of that conversation in the State Board of Health.
Thank you.
And also the behavioral health. Everybody's wrestling with the same stuff. The Behavioral Health Advisory Committee, and so one of the things I'm going to be talking that we need to put on the agenda, Vicki, while I have it on my mind, is to see if I can get a replacement for me on the Behavioral Health Advisory Committee, because it seems like I have virtually, I make about one meeting a year that I don't have a pretty big bunch of conflicts with.
I think that's come up too. Okay. I'll put that under business, AIHC business for our December 2nd meeting.
This is Jesse.
Hey, Jesse.
I believe we sent out a Dear Tribal Leader letter because Steve, you reached out to
that sounded familiar.
Yeah, and so I believe we've actually gotten 2 names, but I want to confirm because we have so many Dear Tribal Leader letters and so many meetings.
Okay, thanks, Jesse. I'll connect with you on that when we talk tomorrow. Another question.
Vicki, this is Marilyn.
Hi, Marilyn.
I just wanted to make a comment about the transition with Secretary Wiesman and the current team of Department of Health. But the other reason I want to make a comment is I just had a meeting with our regional ACH, and the local health jurisdiction have there's some appointments that are happening right now before Secretary Wiesman leaves with regards to how the vaccine's going to be distributed within the state, and decisions that local health jurisdictions are having to make in the coordination of the COVID-19 vaccine. And a number of the local health jurisdictions just feel that they're getting to coordinate the decision making that's going on in the state. And so in our region, the local health jurisdictions of the 5 counties have determined that they are going to work within the region with the ACH taking lead with regards to the coordination of COVID-19 vaccine. Seems that not only Secretary Williams leaving, Dr. Loki is also leaving, and so it seems that there's a lot of local jurisdictions, a lot of
is it me or did we lose Marilyn? Oh,
yeah, Marilyn, if you can hear us, we heard about 1 out of every 4 words, and those were garbled. And the stuff that I could hear was some important things that we need to consider. So, are you still on there?
Looks like she's back. Let's give her a second. In the meantime, Lucy says it was a back to your question about the Behavioral Health Committee, Steve. It was a Dear Tribal letter. It was for Children's Behavioral Health Work Group, and we did get interest from tribal representatives to sit on the group. We got from 1 to 2 responses.
And that's the one that the legislature runs, right?
Steve, this is Lucy. That's correct. I think that's the one you were sitting on, right?
Well, no, there's the Behavioral Health Advisory Committee, and then there's the Children's Work Group. That's 2 different ones.
Okay.
I sit on both. And Nicholas,
yeah, we sent a letter specifically for the Children's Behavior Health Work Group. That's within the governor's office as well.
Okay.
Oh, I think Marilyn's back. Let me try and unmute her. Did I get it? There we go.
Okay. I lost my connection there for a minute. But what I was saying is that the local health jurisdictions, at least in my region, are really concerned about the way the process is going to work once Secretary Brown leaves and Dr. Loki leave. And when I participated with the one group yesterday, that came back. There's some things that were inclusive when I was raising questions around the distribution of the vaccine, and whether the authority for the vaccine and tribes are not utilizing the priorities that he recommends.
The tribes are not using the priorities, or the state is not going to use them?
Oh, no, I think the concern was that it sounded like the concern was that, again, if we're getting our vaccine through the local health jurisdictions and the tribe's priorities don't align with theirs, are we going to continue to have problems like we did before? Is that what you were saying, Marilyn?
She's getting muted when we lose her.
Well, so it's important that we put vaccine distribution on as one of our hot issues here going in. I think that's kind of where she's getting to it. And what we know is that tribes as governments, if the vaccine distribution system that starts playing out in our different regions, if it's not working, they're going to need to fix it, and they're going to need to fix it fast.
Yeah. Lou?
So all of the kind of documentation that I have seen, there was even a meeting this morning that was between the Washington State Department of Health and local health jurisdictions. And in that meeting, in Friday's local health officers meeting, and in other meetings that are coming up, Washington State Department of Health is sharing the language that they have adopted that clearly states that tribes have the sovereign authority to determine their own priority groups. And I think the Department of Health is making a real effort to make that clear to all of the local health jurisdictions that they have no authority over how tribes prioritize their vaccine allocations. And that was clear in the meeting this morning. Also, DOH has scheduled 2 upcoming trainings regarding medical countermeasures. They're calling them seminars, and these are for both tribes and local health jurisdictions. And that is one of the issues that they really want to make clear. So in the language that has been adopted by DOH and in the slides that they are using for orienting all of the state's local health jurisdictions, they're using the language that clearly states that no state nor local health jurisdiction has, they have no authority over how tribes prioritize their vaccine allocations.
Do they also, are they also having to honor them? Is the language in there that they have no authority and they need to recognize tribal priorities? Because that's
Yeah.
two separate issues. Okay.
So, and well, could you kind of clarify your distinction there?
Well, the first, the point that you had just mentioned is that they don't have, that tribes have the authority to determine their own priorities for the distribution. The part that I'm bringing up is connected to that, but that the counties or the healthcare, county healthcare, that they recognize that. So they have to not just know it, but they have to recognize it in implementation, that they won't be penalized.
Yes, they have to respect it and they have no authority. They can't take any actions that are counter to what the tribes determine to be their priorities. And Vicki, if you share the screen with me, I can display the slide that DOH has been using.
While she's doing that, let me just say that I have a broader concern, and the information that we needed to provide to you really was difficult for us, because I think that in some ways the vaccine is going to roll out in vaccine for an area in the state, a county or whatever, and if a tribe's in that, and we have and we have a bunch of people at cross county lines, and we have, and so you know we cannot just rely on one county to give us our vaccine.
Right.
And
so to clarify, the counties have nothing to do with the tribe's allocations for the COVID vaccine unless the tribes want the counties to. And as far as I know, there's only one tribe that has made it clear that they want their allocation to go to the LHJ. With the COVID vaccine, the vaccine is either going to be distributed directly from the manufacturer using McKesson to each tribe, or for the ultra cold storage vaccine, that may have to go to some locations that have ultra cold storage capability, and then from there distributed out to tribes. But for the distribution of COVID vaccine, the local health jurisdictions have no role in getting the vaccines to tribes, unless the tribes, and there's one tribe in the state that has said, we want our vaccine to go to the local health jurisdiction.
And this is Heather Erb. It's not on this slide, but in answer to Nancy Dufresne's question, I believe, there is specific language in DOH policy, the Annex 9, that specifically prohibits LHJs from attempting to assert authority over tribes when it comes to vaccine prioritization, or for that matter, yeah. So it's not up on the slide, but there is specific language in the policy, yeah.
Thank you.
And again, the vaccine is not going to be for tribes, will not be going to local health jurisdictions. Most of the vaccines that don't require ultra cold storage will be sent directly from the manufacturer and distributed by McKesson, because the federal government has made an agreement with McKesson for distribution of the COVID vaccine. The only exception is the one vaccine that requires ultra cold storage. And so that one may need to be sent to some various locations throughout the state that have that ultra cold storage capability, and then to be distributed from there.
Thank you, Lou. I know this is something that we're all worried about, and Lou and Heather have been working really hard on this. We've been coordinating with Laura and her team at the board on the federal level to try and make sure that what we know happened in the past does not happen again. So, and I think it's still something that definitely should be on the talking points, and that should be make sure that the governor's aware of in case something does come up.
Definitely.
But
yeah.
But we've done, these guys have done so much great work trying to, and the Department of Health adopting the language and putting it in their plan was really, in my mind, and I think Lou's, very important, a huge step forward.
Yeah, so what we can probably say is there's a huge opportunity for things to go right, and there's some opportunity for things to go wrong.
Right, yeah. I mean, you hope for the best, plan for the worst, right? Isn't that the definition of tribal health care?
Yeah, and this is Heather. I just wanted to add that compared to the IHS COVID distribution plan, the language that DOH is going to adopt is much clearer about tribal sovereignty and prioritization decisions, and less muddled than in the IHS plan when you compare the two. So I know tribes have already made their decisions, but just something to consider. There's been a lot of work by the board and the commission working at the federal level, but it's been more difficult and challenging to get language that's more favorable to tribes and urban Indian health programs.
Look outside.
Oh,
And I agree with what Steve said, that, there's, a lot of good opportunity for things to go well, but there's always a chance for things to not go well. And so we definitely need to be doing everything we can beforehand and getting ready for it, and definitely raising the issue with the governor and at higher levels to make sure that everyone is aware.
Mm-hmm. Thanks, Lou. Didn't take back the screen. Somehow.
So how much time are we going to have to present on the health issues at from at 10:40? That's 1 hour. So there's the 1, 2, there's
15.
6. What are we going to get? Like 10 minutes?
Well, social services going first, so depends on how much time they take. At least we're not last. I think Craig said 15, 20 minutes when we first started the conversation. I'm not sure if it's
Yeah, well, they have everybody factored in between 10:45 and 11:45, right?
No, I think they're starting earlier, is what he said.
Oh, do they have? I thought I printed off the most recent one. I didn't, huh?
That was the most recent one I had. The times he gave were a little different. I don't know if Mystique.
Are they going to send something else out tonight
Yeah.
still?
Yes, I am just waiting on somebody to confirm a time frame, and then I'm going to blast out the updated.
Okay. So there'll be a little more time for that, Steve. I think 15.
We, for the work session, we have from 10 to 11:10.
Oh, we can't hear you, Mystique.
The work session, starting at 10 a.m. on the 19th, will be from 10 to 11:10.
Okay.
So where did you see that?
Well, that's Mystique from the Governor's Office of Indian Affairs. So she said she's waiting for one more piece of information from somebody and she'll send out the update. Is that what I heard?
Yes.
Sorry, you're a little quiet. Thank you. It'll be in your email soon, Steve.
Okay. So when I'm gonna need some time to get together with you to pull together the talking points then.
Well, if we can just get through these next few slides, I want to throw some things up to try and get it narrowed down. I've got, but we missed Cindy's input from the chat, so I want to go back and capture. Where'd you go? Oh, Cindy, are you with us now? There we go.
I am. Sorry about that. So yes, the CHAP in Washington State session went very well. We had Sue Stewart and Christina Peters from the board who did a great overview and update on where we are. And we were able to really make a nice case for the benefit that these type of mid-level providers bring to a tribal wellness center or clinic and to the community. We had a lot of time for discussion. It was a very rich discussion and a lot of questions, detailed questions, and interest in what it meant and what it would take to become that type of mid-level provider. And so it was a great discussion. We were all really enjoying it. And I just have to tell you that 5 minutes before the session closed, we got a question that just really made my heart grow. And that was a question, will there be a maternal and infant health provider? And so, of course, I was thrilled. I was able to talk about the commission's resolution from 2 years ago to advocate for the establishment of a MIH reimbursable provider type. And so we have formally received that inquiry interest. So I think it's just very thrilling that people are thinking that way already, that this is an opportunity to have some sort of maternal and infant health support through the CHAP board, through the CHAP program, that would be available for our communities. So I just wanted to share that. It went well, and then the MIH issue was brought up. So very exciting. Thanks for the time, Vicki.
Yeah, thank you, Cindy. So that brings us up to here where, oops, I'm just gonna open a Word document if I can figure it out. Maybe I'll just type on here. So here are the things that we already knew were issues for 2012. Wow, I was having a bad morning. Here we go. And then these are the things I've heard. Let's see. I don't know how to get to my email or how many things I have open at once. Okay. So let's see if we can just. Sorry. So these are some of the things that I typed on my other computer and then emailed to myself. I think the vaccine is probably the first and most important one, right? And so pull these two in there. And then the budget, and then meeting with the new secretary, or should the meeting with the new secretary and the old secretary. Oh, is my screen paused? You're not seeing any of this. That's probably good. Okay. Can you see what I typed? No.
No.
Okay. So.
Well, I just look at, so what we want to do is talk about the importance of setting a quick working relationship, or rapidly set a good working relationship with the new Secretary of Health, I think. And maybe leave it at that, because the Secretary of Health, well, all of the secretaries are important to us, but this one right now in the COVID crisis is extremely important.
Yeah. Okay. So
this obviously, was not in anybody's long-term plans, but this is not the optimal time to have a change in administration, although we're having the same problem at the national level. So what am I talking about, right?
well, it might be a good change at the national level. Okay.
It depends on which Kutz brother you're talking to about that, by the way.
Aren't you glad you don't have to be together at Thanksgiving?
Yeah.
Okay, so we lost. Oh, Cindy Talina had a question. Cindy, does the chat board have anyone from DCYF on it? And that's actually maybe more a Laura or Sue question. So this is why I have our talking points. It's kind of messy, but meeting right away with the new secretary and the outgoing Secretary of Health.
If that's possible.
Yeah. And then discussions about how the COVID has impacted budgets and workforce, and then equitable distribution of appropriate, because there might be more than one vaccine, COVID-19 vaccines. And let's see. And then issues of resources about infrastructure.
Right, around foundational. I mean, realistically, what we can say is that this time, more than any time in recent memory, has demonstrated the need to have a strong public health infrastructure in the state that includes a robust tribal presence.
Mm-hmm. And then
so who's chairing the Centennial Accord from the tribal side? Do you know? Is it Mr. Cutoff Steve, John, Ron Allen?
Ron Allen? I don't want to take that question, Miss G. No.
Yeah, they always try and balance their schedule on the health side. I've noticed that over the years.
So then the funding for infrastructure for public health, data. No, that's all. These are both the same issues. So I'll put those together in one thought. And then also, how does the data work for urban and non-reservation Indians?
Yeah, the data collection problems that we're having for Indian people across this country and in this state is profound. And we know a little bit of that because the administration policies on collecting data has caused Indian people to disappear into the woodwork, data-wise. And we ran into that. We ran into that on just trying to figure out how many Indian people were on Medicaid when we started doing the deep research with Jesse and his folks here, like about a year ago. Maybe it's a little longer than that.
Yeah. And then I emailed me the wrong.
So was that what we wanted to get on DHATs though? Is that all? Is we just wanted to talk about making it billable, or is it just making it billable for us and also billable for urban Indian health organizations? Is that the two things that we want in there?
And I guess it's including, so to solve the billable services for the behavioral health aides, I know there's a state plan amendment coming, but there's probably legislation needed to fix the DHAT bill, because that's been a ongoing problem, and something for community health aides. And so if we do legislation, we might as well try and fix it all. But I know legislators don't seem to like that, but it should be that we can all bill for the services of community health aides, behavioral health aides, and DHATs in the Indian health delivery system, in my mind. Is that, Meryl? Go ahead, Marilyn.
When we're talking with the tribal leadership, the Centennial Accord, we're going to get some pushback from tribes about the urban. The only one that currently is supportive of the expansion for the urban currently has been, Andy has really been bringing it up in all the meetings that he's been on, that I heard him raising that because we all have tribal people that live in the urban areas, we want them to be able to receive the same care that we get within our tribal health system. So the thing that I'd like to see in the legislation is the authorization for CHAs, BHAs, DHATs, or American Indian Alaska Native population within the state. And, the one thing that's the pushback from CMS has been when we're talking about the Medicaid population, that we're not looking to expand services to include the Medicaid low-income population. And we were not attempting to exclude them originally in the bill that was passed in the state. We wanted to just be able to authorize DHATs overall. And so we thought that it was a good idea to put specifically within the Indian healthcare delivery system, but then that's when CMS came back and said we were being discriminating.
So Marilyn, if we just said, some tribes that might be using DHATs may in fact want to provide services to the non-native, and they ought to be able to bill for it. It's not our fault that these dentists across the state are not going to want to use DHATs in general out there for the general population. That's their problem, not ours, right?
Yeah, I don't know if Laura had to go already.
Well, I've
think
been supporting funding, but this is not a state issue, really, on getting the FMAC funding for urbans. That's really a federal issue. I mean, the state. I mean, that our conversations really aren't going to be at the state level on that issue. I don't think. Marilyn, do you?
No, that's going to be at the federal level.
Yeah. I mean, I've been pushing for it. I've been supportive. You know, you have to have a some balance in the funding, and the urban programs are so woefully underfunded. It's unbelievable.
Right. And I think in order to make it happen at the state level for the urban programs, it is legislation. And that is a conversation maybe with Christina Peters and Sue Stewart that I need to have again, because I feel like that is where that idea came from. So I'll work on that and try and get that. If there needs to be language, we'll for the state. I know that you're saying it's federal, but there is also something that needs to happen at the state level, whether it be state plan amendments or legislation.
But that's for the CHAs, BHAs, and DHATs specifically, to get them included in as a fundable service provider, right? That's what we're asking for.
Yeah, that their services are billable and payable through Medicaid. And it'd be great if other, private insurance.
And the state has is essentially having somewhat the equivalent of those other two, except they don't for the DHAT, but they're putting mechanisms in place for something similar for. And I'm sure they want that reimbursed.
The one thing that I thought we already had authorization when the state legislature passed the bill last year, extending behavioral health services to include peer mentors and the recovery coaches and, all of those mid-level providers in behavioral health. The state passed the legislation to encourage. So I thought we were already good to go with regards to behavioral health aides, because we're talking about similar, might be a different title, but it's the same training that those peer mentors and the behavioral health aides have. When you compare training requirements for mid-level providers, it is the same track. It's just in the behavioral health aid track, there's more cultural specific titled training when you look at the actual curriculum, it's the same training. So I thought that was going to be a shoo-in for us with the legislature, because, when we got the Behavioral Health Aid Act passed, that we were already good to go.
Well, and, the Healthcare Authority feels we need a state plan amendment. I know we've had conversations, Marilyn, and with Andrew and Sue, that we feel like we don't. So this is another one of those things where it's, I don't know if it's that it's really necessary, or it's just wanting to make sure we're doing the right thing. Yeah, it's something that we really need to nail down. What is it we have to do in order to make these, and maybe that's the talking point, is just the work needs to happen to ensure that we have a clear path to services of these providers being billable And it doesn't have to be for the American Indian and Alaska Native population. I think that gets us in trouble with CMS.
Yeah.
Right. And we would want them to be able to provide services to whoever in the community. I mean, that's the current issue with the DHAT bill, is that it assumes that all the patients that a DHAT would see in a tribal clinic would all be enrolled tribal members of a federally recognized tribe, and that's just not so. So I'll work on the language, but I think the talking point really needs to be is that the work needs to happen to figure this out once and for all. What's the path to make this happen? And there may be already a path in place for the behavioral health aid.
Well, I think that we already actually, even though we're not ready to roll out the CHA part of the CHAPS program, we already have a pathway for that. And we were able to get the CHRs when we demonstrated what tribes utilize and what training they have had included in authorized provider for maternity support services. We were able to, the CHRs included in the team that's authorized to participate for maternity support services. And that's a specific program, but that's a pathway for the, I'm not saying that the CHRs are the same as a CHA, but the CHA is actually more medically trained than the CHRs, the way some tribes utilize their CHRs and what training they provide them. I definitely know the difference in that, but some tribes utilize their CHRs as medical assistants and have provided